Hello, everybody. Hey, it's Dr. King-Mullins, Dr. Tishy Touch Up, and I have Erin Webley here.
Hi, everyone.
All right, so we're excited for the conversation tonight. We're waiting for Kristin to join us in a minute, so we'll give her a few moments. Hello.
We did it.
We did it. We did it. A three-way. All right, well,
Yay.
let's kick this off. So I'll just get us started. So for those who are joining us, I'm Dr. Erin King-Mullins, double board certified general and colorectal surgeon in Metro Atlanta. And this is our Love Below series. So we're doing it a little bit different tonight. I have two guests on, but I couldn't, it was one of those, who do you choose? You don't. You get both of them. And so So we are talking tonight with two amazing registered dietitians who have been in the healthcare game for a long time, focused on gut health. And so I'm going to start by introducing Erin, who actually works with me in my practice here in Metro Atlanta. And so I'm going to let her introduce herself, tell us a little bit about what a registered dietitian is, and then we'll talk with Kristin as well. So take it away, Erin.
All right. Well, thank you so much, Dr. Mullins. Again, I'm Erin Webley, registered dietitian. I've been a dietitian for it was 19 years actually last month. So it's been a while. It's funny. I don't even think I'm that old, but but yeah, I actually started out in the GI world. I worked inpatient for a while. I also work in weight management and do some work with autoimmune diseases. As far as a registered dietitian, I guess from my perspective, we're just we're guidance. We're guidance for you. So a lot of us know what to do. A lot of us know what we could do better with nutrition. And so we're here to just guide you along the way to help you make sense of all of it. There's a lot of information out there. So helping you to, prioritize what matters to you and your health and just provide that support and that guidance on your individual health journey.
Awesome. Well, welcome to the conversation, the love below. Kristin, coming from the West Coast. So I didn't tell y'all that today is an East Coast, West Coast battle.
Ooh.
All
That's
right.
right.
So we may have some interesting conversations with different food preferences because it's East Coast versus
Right.
West Coast. But
That's right.
Kristin,
Um,
tell us-
and, and oh yes, and that's what dietitians do, right?
yeah.
According to where you are and what your current, typical preferences are, that's what we work with, right? We don't try and force any kind of a diet on anyone, of course, unless you have a situation where a particular food does actually make you sick. We help you find alternatives, but within within the foods that you already enjoy, right? Or we introduce new foods that maybe you haven't had the opportunity to explore yet.
Yeah.
But yes, okay. So my background, I am a registered dietitian. I became a dietitian back in 1995. So I've been doing this for a little while. And the entire time has been focused on the gut microbiome and weight, how the gut actually influences our weight. So it was about 10 years ago that I really started to notice that it is a common, very common for, in fact, most people. I have it on my little sign behind me, but 95% of the population actually is fiber deficient. So, the patients that I was working with, they all said, "Oh, I get plenty of fiber," and I said, "Well, how much do you think you're getting?" And they would always say, "Oh, I mean, I don't need to worry about that. I'm good on my fiber. I eat my fruits and vegetables." But unless you're really counting and really, really paying attention to how much fiber you're getting every day, it's an easy one to miss out on. So because of that, I developed a product that promotes weight loss, balances blood sugars, reduces cholesterol and triglycerides, fixes many tummy troubles. And the great part about it is there's no taste or flavor. It totally dissolves. You can cook and bake with it, and no side effect or very little side effect. So it's something that you don't have to change or give up your favorite foods. It's something that you would just add to your current lifestyle.
Yep.
So
And so I
that's
have a
my little
video of
story.
me putting it in my coffee, actually. So,
Yes,
so
yes,
I do put it in my,
yes.
yeah. So we'll definitely talk a little bit about like Just Better Brands and kind of what you came up with and what you created as a
Yeah,
resource for patients. You know, there's white papers about the product that you identified, and so we'll get to that shortly. So I want to have a little bit of a conversation right now, kind of a three-way conversation, because I often, as a colorectal surgeon, get the question, well, doc, what should I eat? Right? And it's so complex because, as you all know, patients have different medical conditions. They've had different surgeries. They're on different medications.
yeah,
They have different food sensitivities. And so, you know, it's not as simple as saying, eat more fiber, drink more water, or those types of things. Sometimes things are very nuanced. And sometimes it's not about educating them or telling them what to eat or what not to eat. It's more so telling them how to
sure, sure.
eat, right? And so let's start off with Erin. Just tell us a little bit about how, you know, a registered dietitian can benefit a colorectal patient, for example, in the realm of colorectal cancer.
Okay, absolutely. I think, with any condition, it is very individual, right? So we're looking at what's happening after the surgery. Are you having, I've had patients come to me and they're having still lots of pain and bloating and things like that. So looking at, whether you need, of course, do you need more or less fiber? What kind of fiber do you need?
Yeah,
Um, do you need like to eat a little bit more frequently in smaller meals so that your body can absorb and adjust a little bit better? How is your water intake? Are we moving? So a lot of this comes down to some of the foundational things that we all should be doing, right? We should be drinking our water and refueling every 2 to 3 hours if possible, eating balanced meals with lots of vegetables, a variety of vegetables, and adequate protein and whole grains and fiber rich foods, and moving. So a lot of it comes down to the basics.
yeah,
And then what I do is kind of look at your individual case, your individual health information, and figure out, okay, how do we make that work, right? Because I think that's what it comes down to. How do I make it work in my lifestyle? I'm working, maybe I've got kids or grandkids that I'm taking care of. I'm a caregiver for somebody, just the different things. How do I make it work in my everyday lifestyle? And I think that's where dietitians can really make a big difference, is really making it practical. How do I do that? How do I do this when I work a job where it's hard to get away and take a break to eat or drink or something like that? Or maybe, I have a long commute to work or something like that. How do I make this work in my everyday life and be something that I feel like is attainable, right? Because that's the biggest thing. People feel like they can't do it, then they're not going to do it. And so my job is to help you see that there are ways and strategies to do it.
Yeah, perfectly said.
Mhm.
Perfectly said. And so I'm going to follow up with that and kind of switch it up just a little bit, you know, because not only do I see and take care of patients with colorectal cancer, you know, I take care of patients with, you know, inflammatory bowel disease, or various other chronic conditions, you know, diabetes, heart disease, and things like that. And so, Kristen, tell us a little bit about, you know, how a registered dietitian plays a role there, you know, when we're talking about chronic disease states, especially that may affect the gut. Yeah, tell us a little bit about that.
well, um, like I mentioned, I started to recognize there's this common denominator that I was seeing in so many of my patients, and whether it be diabetes or cholesterol or cardiovascular issues or blood pressure, but they were all missing out on getting enough fiber. So of course, and we are dietitians, we are food first dietitians. Um, it would it is ideal, and in a perfect world, for all of us dietitians, we want all humans to get all of their nutrients through whole unprocessed foods, right? Our bodies recognize those nutrients best. However, there are situations where a supplement might be a good idea. And on occasion, sometimes the treatment for some of those conditions, whether it be a gut condition or maybe even mental health medication that actually causes a side effect that creates a situation in the gut, right? And so that's where a supplement might be a good way to go. But first is food, whole unprocessed food first. So of course that means all your fruits and vegetables, your whole grains, lentils, beans, and all of those things. But a good place to start is just to know how much you should be getting every day. So the guidelines say that women should be getting about 25 and men should be getting about 38. I like to simplify and just say let's shoot for 30. Everyone, let's just shoot for 30. It's an easy number to remember. And if you're doing 3 meals per day, then if you divide that up into, just 10 and 10 and 10, that's an easy way to do it. But again, it is really challenging to do. Even myself, trying to do that on a daily basis was really, really hard. So again, that's the reason why I developed a product that would help people that have a tough time getting all of their fiber every day.
And so I'll stick with you just for a minute for a follow-up.
Yeah.
So let's talk about like what does an initial consult looks like with you. You know, a patient has been sent for whatever reason. Tell us what a traditional initial nutritional consultation would look like.
Oh boy. So when I work with a client, so I do things a little bit differently. The way I explain it is like if you're familiar with the dog whisperer or the super nanny, right? So I
Right.
actually kind of step into my client's world and I study their lifestyle, their not only their food preferences but also their pattern throughout the day, and even what route they take to work. Um, Once I do that, I actually study their lifestyle, and then I come up with a plan that includes small tweaks over time that are very realistic and sustainable, not only for themselves but for the whole family. So I do things a little differently, but I bet dietitian Erin might have a more traditional way of working with clients. Also, too, I don't have a time limit, so I can take as much time as I need for each patient or each client. But yeah, dietitian Erin, maybe a better.
Yeah, it's interesting because I
Thank you.
actually have been very, and I won't say I study, but I'm very similar and
Yes.
I'm very much focused on, what is your lifestyle like? What's
Yes.
when you get up in the morning? What do you have to do? You have to get kids ready? What
Yeah.
do you do? We're going to exercise. I really want to know about your day-to-day life, right? I really want to understand what's happening, what you have to, the things, the challenges that you may come across, the things that you do on a regular basis. And so, I'm also doing like a full like history, what's your health history, what kind of medications are you on? If you have any labs that we can review, we talk
Yeah.
about those. And then, kind of assessing, how's your motivation? Like how motivated do you feel right now? What can
Yeah.
you do to, motivate you more? What would help? What things motivate you? So I'm really getting a whole picture of the person and their lifestyle, again, to your point, to help create a very individualized plan, because none of my plans look the same. I'm not making a cookie cutter thing and saying, hey, go out and do this. I really want to make it tailored to you. And I ask about your family, like who lives with you? Who do you cook for? What do you
Yes.
have to, how do they interact? Are they buying groceries? All those kinds of things. Are they on the same health journey as you? And you, that's a
Right.
big thing, because you might be the only person on this health journey. And so that's important to know, who do you have for support. So
Yep.
again, I think that's really important. Of course, we need all the health information, but we
Yep.
also have to get a good understanding of this person's life and what they're dealing with day to day. And then I also ask, what are your goals? What would you like to work on first? What's important to you, so that we again come to like a middle ground, and then
Right.
I'm walking alongside you as you work toward your goals.
Yeah,
Right.
that's great feedback and approaches to again. So, for those who are just tuning in, thanks for joining the Love Below. We are joined with two amazing registered dietitians, East Coast Erin, West Coast Kristin. So I mean, thanks so much. But you're uh thanks so much for y'all joining us tonight because this is such an important conversation. And I am like right now hereby declaring we're gonna change the name. We're not calling you all registered dietitians anymore, not in my lingo. We're going to call you nutritional coaches, right? Everybody, the life coaches, right? The life coach is the end
Yep.
thing right now. Everybody's got a coach. But listening to, how you all just explained what a consultation looks like, it's about picking up on the strengths and weaknesses of your clients, of patients. And so isn't that what coaches do? When we talk about, it's World Cup right now. So let's use that,
Okay.
so the different, the coaches that are guiding their players, they know what their strengths and weaknesses are, and they have to build upon those and how to, transition and get them to shift away from those weaknesses. And so understanding truly what a patient's lifestyle is, what's their sweet, are they a sweet tooth? I'm a crunchy and salty, give me some pickles and chips. Type person. But if
Yeah.
you have a child, a loved one, a significant other, or someone in the house that's gonna like just pull on those heartstrings every time and get you to buy that Kit Kat, we got to figure out, maybe you make your own Kit Kat. Like, how do you make something that tastes and
Yeah.
looks and feels like a Kit Kat but is more nutrition result? So we're calling y'all nutrition coaches now, so that's gonna be the new name.
It is. Right, right. And like you said, and also working with the clients' limitations, right? I could, make recommendations until I'm blue, and my words won't mean anything if I'm not listening to what they tell me. Or like a perfect example, like I can insist that drink at least 20 ounces of water the first thing when you wake up, and I can see people like a little bit glaze over, or if I need to ask what they do for a living, and because right, if you need to go to the bathroom several times throughout the morning, and that won't work for many people, like our teachers.
I teach, yeah.
That's it. Or surgeons, right? You can't be a university. Yeah, right. Um,
Like, put your
many,
finger right
many,
here. Hold, hold that close.
yeah.
No, just kidding.
Right. So, right, we really have to pay attention to what everything about the client, the patient, um, and work with their limitations. If yeah, and whatever they might be.
Yeah.
Right.
And right now, I think one of the very difficult limitations and constraints for patients right now is price, right? When we look at
Yes.
what the price of whole foods may be,
Yes.
or living in particular food deserts,
Mhm.
kind of may be. So what are some like nice, whole, nutritious, cost-effective foods that if someone's watching this right now, if they could just go to the grocery store and they had enough money, maybe they had $30 and, you want them to buy these at least three or four things, throw out some things that they, would be the biggest bang for the buck for them. Go first.
Oh, okay. My goodness. First of all, to if you can, or if you have a local like farmers market, often many communities have a once a week farmers market. That's a great place to start. But my goodness, the things that are pop into my brain is to eat seasonally. First of all, they will tend to be less expensive. And variety is important. We should never eat the same thing every single day. So eat what is in season. Right now, berries are in season. Um, so
Berries are high fiber. They're one of the highest
yes,
fiber content foods out there. Everybody thinks
that's right.
apples when you say fiber, and it's like, no, raspberries. So,
Yes, exactly. So if you like the berries, explore. There's many oftentimes I'll bring up things like, Marion berries, or in the Northwest, we have many different types of berries, right? So it's a good idea to not only eat seasonal or choose foods that are in season, but explore, the fruits and vegetables that are you can afford, and but try new things, right? Even if it's just one new thing a week.
Yeah. And so, Erin, tell us a little bit about, so, and to temper this conversation as well, we're in, Metro Atlanta, we're in the Deep South. We see a lot of traditionally Southern people, and to be honest, when we're talking about fiber and the various types of grains and all that stuff, they don't want to hear about couscous or quinoa. Like, I'm just going to say,
Oh,
they want to hear about
okay,
rice.
There we go.
They want to hear
okay,
about potatoes. They want to.
okay.
So, Erin, tell us a little bit about, like, maybe some things and how you encourage some of those more traditional foods that we like to eat in the South, like how they can um, eat that responsibly, both fresh, but also like maybe in an inexpensive fashion.
Yeah. And I think sometimes, again, it's about meeting them where they're at, right? So trying to figure out, okay, these are some of the things that you like, okay? Would you be willing to try it this way or this way? Rice, for some people, even just trying to switch to brown rice, or could you mix them?
Yeah.
Could you mix them? A lot of people will do the white rice. So can we mix? Can we start by mixing some brown rice and some white rice? Can we do that? Can we add some like beans? You can get beans, you can get dry beans. Some people are a little worried about that. So, okay, let's start.
Yeah.
Again, we like to do fresh, but again, we're meeting people where they're at. We're talking about being cost effective. We're also talking about sustainability, right? Because we have to
Mhm.
worry about, do people have places to store this stuff? Do they have the equipment to make it? You got to think about all those things. So even looking at some canned things, that are low sodium, rinsing them, thinking about things like that, just to like beans, just to kind of introduce them. Again, it's all about meeting them where they're at. Even something people are like, well, you look at something like chia seed in it itself, you can get a
Yes.
lot of it, for not a lot, and it can last, right? And you can sprinkle
Right.
that on lots of stuff, right? You can sprinkle on everything. And so using that as something just to add fiber to things. So again, I think it depends on the person and what they're willing to do, but just throwing some ideas. And some people are, um, they're very open to making small changes.
Yeah.
And so we
Yeah.
might view them as small, but to them they're big, right? Because that's like my rice, my potatoes,
Yeah.
and if potatoes are actually pretty nutritious if you don't eat a lot of them and you're eating the outer skin and things like that. So you have to meet people where they're at. If they're only getting like 10 grams of fiber, we're just trying to get to 15 right now. Just trying to get five
Yes.
more grams
Right.
of fiber per day, and we'll work up from there. So
Yep.
it just depends. But I think looking at, finances, being able where they're storing this thing, their ability to cook some of these things. And for some people, it's a mix of finances and convenience too, right?
Right.
It's not just, money. It's like, I don't have much time to cook. So how do we manage
Yeah.
that too? Yeah.
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 And so I'm gonna kind of slightly switch gears just a little bit before we start fielding questions, and then after that we'll kind of wrap up with you introducing kind of just fiber, telling us where we can get that, and we'll share some information on how you can maybe get a consultation with Erin and I. So, the impetus for this series that I've started, the Love Below series,
Yes.
it came on the heels of, me creating the Tushy Touch Up procedure,
Mm.
which is a tailored procedure for folks who have some difficulties in the anal rectal area for restoration. So if they've had chronic constipation that have caused hemorrhoids and tags after childbirth, prior surgeries, but at the core function of the impetus of having those difficulties and the recovery even after
Yeah.
surgery is the bowel function, right? Like, how are you explicitly moving your bowels? And there's pelvic floor dysfunction and so many things that kind of go into that. So one of the things that we always talk about is making sure that the texture, the consistency of your bowels are appropriate for you to be able to evacuate. And so how do we guide patients on eating appropriately to be able to, move their bowels? Because constipation is a big thing. So, Erin, tell me about that initial consultation discussion, and constipation discussion.
Yeah. That's a common concern as we age, because things are slowing down in our bodies anyway. And so again, thinking about, a lot of people are not eating enough, and that's
Yep.
a big issue. A lot of us are not eating enough. We're eating maybe once or twice a day, and that's just not enough to have that movement, to have that smooth movement that we want to see. And so again, looking at, are we trying to refuel our bodies? Are we staying hydrated throughout the day? Are we getting fiber throughout the day? But again, it comes down to those basic things. Are we moving? Because movement is a big piece of the
Yeah.
whole
Yeah.
of the whole puzzle. Are we moving? You got to move to stimulate those bowels and get things going in there. So again, looking at those things. But what I've been finding is really interesting is that a lot of people just aren't eating enough and eating as frequently. Now, I'm not saying you can just go out there and eat whatever you want all the time, but they aren't eating balanced meals to support, a healthy bowel movements.
Yeah.
Literally, yeah,
Yeah. I mean, there's a whole gut brain connection, right? We call it the gastrocolic reflex.
Yep.
Reflex. Literally, when
Yes.
you eat, your body understands that more food is coming in, so something's got to move out of the way.
Yep.
And I mean, it's kind of how your body's built. So people are like, yeah, I eat once a day. Well, your body is in storage mode because it's like, I don't know when my next meal is coming. I don't know when my next, nutritional replenishment is coming. And so it kind of stores it and holds it. So, Kristin, tell me a little bit about some of your go-tos on this constipation conversation, and then kind of follow up with telling us about what just better fiber is.
Yes. Oh my gosh. I just happened to give a presentation for the Parkinson's Foundation, and specifically about gut health. This one here. Uh,
Yeah,
how can you see this one?
yeah, a
Uh,
little bit. We can see it.
yeah. But the first part, you probably use the Bristol scale.
Mm-hmm. Yeah.
Yeah. So, as dietitians, I know many people don't want to, talk about this topic, but we're dietitians. We talk about this with every single patient. I tell them we call it the I's and O's, right? The ins and the outs, and that are what the stool that we produce is like a window into our health, overall health.
Yeah.
So it's actually really important that we pay attention to, what ends up in the toilet bowl, right? So, yes, of course, again, I would dive heavy into the foods, figuring out what my client is getting and what they're not getting. Now, if it is a situation where a supplement is a good idea, then that might be a time where I would suggest something like Just Better Fiber. I developed it because it was so easy. Um, I came across it's a food uh, additive essentially. I came across it in the literature when I was doing research on fiber, and it not only had hundreds of clinical studies, but the research said that it totally dissolves. There's no taste or flavor. You can cook and bake with it, so it's temperature stable and no side effect. So I tried to get it for myself and my clients, my family. I approached the manufacturer and they wouldn't sell it to me. They have no interest in retail. So the only way that I could get my hands on it was actually to develop a product. So, um, the part about my job, because people think, oh no, here comes the dietitian. She's going to take away all my favorite foods, right? Yeah.
Mm-hmm.
Yeah. No. So this is something that I developed that you don't have to change anything. Okay. There's probably things that all of us can improve, but this is something that you can just simply add to what you're already doing or whatever diet regimen or lifestyle you're following. This is something that you can simply add to your beverage or to your foods. So I add it to my like scrambled eggs in the morning, or in the evening I'll add it when I'm making stir fry, or I put it in the rice cooker, or you can put it in mashed potatoes. All right. The way that industry uses it is actually to improve mouthfeel, so it makes things taste better. So it's either that or they use it to mask a flavor. Like if there's an unpleasant, maybe some of the vitamin type products that have that yuck, like B vitamin taste to it. So they're using this fiber product not for therapeutic benefit, but simply to make the products taste better. So
And what's it derived from? The fiber, the base of it.
yes, so it's non-GMO soluble corn fiber. So really what it is the byproduct of when they make cornstarch. It's what's left over. So it just so happens that when we eat it, humans don't absorb fiber, right? It stays in the gut and ends up in the sewer. So the wonderful thing is that it totally dissolves. So like even super picky kids, right? You can put it in mac and cheese, or you can put it in Jello, you and beverages. Don't put it in anything with bubbles in it. You'll end up with like a lava. It'll effervesce, and you'll you'll have an overflow.
Well, the
But
kids want the lava, so it might
well,
be.
okay.
Yeah.
If that's what you're looking for, then yes,
Yeah.
it does do that. But really, honestly, you can put it in any food or beverage, and just 1 tablespoon is 5 grams of fiber. So, if you were to if you're trying to fix some tummy troubles, just adding 1 to 2 tablespoons in the morning is enough. However, if you're taking it to promote weight loss or balance blood sugars or reduce cholesterol and triglycerides, then we're talking about 1 to 2 tablespoons per meal.
Awesome.
So yeah.
So before we so we'll talk a little bit more about that, but I want to just
Okay.
definitely make sure we lend some time to any
Yes.
questions
Yes.
that
Yes.
have
Yes.
come through. So Sonia, let us know. Do we have any questions on the line?
I personally think there are like three really good ones. So we can start with one.
Yeah.
Um, One question came in actually from TikTok. It said, if fiber is so important, why do I feel worse sometimes when I start taking it?
Oh yes.
I'm gonna leave it to you, ladies. Erin, let's
Yeah,
go.
again, your body has to adjust. Your body
Yes.
has to adjust to the change in fiber. So even when I counsel patients to increase fiber, I also actually tell them to gradually increase, because you have to understand that it is going to change. It's going to change the momentum of things. It's going to change just how things are moving through your GI system. So you may feel a little worse at first, and then looking at if you have any other issues going on, because maybe we need
Sure.
to look more towards pushing more insoluble fiber versus soluble fiber
Yes.
for you, just depending on what your health history is. But it's a
Right.
transition. Also, making sure that you're getting lots of water to help
Mhm.
move it
Right.
through your system. So, it's not just take this and you're good. It's other things that you have to do, other behaviors that you have to do to go along with it. Yeah, I'd be
Right.
interested. How do
Right.
you counsel patients with that issue?
You bring up a good point, the different types of fiber, and insoluble versus soluble fiber.
Mhm.
So, for example, if you were to eat a whole apple with the skin on the outside, you're going to get quite a bit of insoluble fiber. But if you're just eating the apple portion on the inside and you don't eat the skin, then you're going to get more of the pectin, right? Even within the same fruit, same thing. The degree of ripeness actually changes the amount of sugars that are available and fiber. So if you eat banana that is more on the green side, it's a little healthier for you and has less sugar than a banana that's more towards the spotty brown kind, right? So also when you're talking about supplements, there's many different types of supplements that are available. Some of them cause more side effects than others. If you tend to be a person that tends to be quite sensitive, I would recommend looking for a fiber supplement that's more on the soluble side, and then also look for the FODMAP-friendly type of fiber, because it's less fermentable. So that's what's causing lots of the gas and bloating. So just butter fiber happens to be a FODMAP-friendly fiber. So yes. So anyway, those are kind of the big deal things. But gosh, there's so many different sources. Whether it be psyllium or inulin or acacia or yes, there's many different kinds. So thank goodness.
Yeah, and that's why I counsel patients. I tell them, I'm like, hey, when I'm encouraging you to eat more fiber or consume more fiber, I'm like, don't go run to Costco, Sam's, BJ's, and get the biggest bulk
Yeah,
of, what's on the shelf.
yeah,
You have to try the different
yeah.
types first to understand how it's going to sit with your system and all that stuff. And so, yeah, you have to kind of toy around with it. And like you said, start out small. Sonia, next question.
Yeah, so that actually kind of leans into the next question, which was actually, does it matter how you get your fiber, like from food, supplements, or gummies even, or is fiber just fiber? So maybe you can kind of put that in layman's terms.
Yeah.
Kristin, take that one.
Okay, for food first, I'll just, if we can, right? Again, we are food first dietitians. If you can get your fiber from whole unprocessed foods, that's the way to go. Now, if you find that that's a challenge, if like me, then that's when a supplement is in order. Another situation, I mean, there's many different situations where it's just not possible. Like bariatric surgery is one perfect example, because the size, the volume of the amount that they can eat, because of the size of their stomach is so small, it is impossible for them to get 30 grams of fiber every day. And so a supplement is required, right? Um, so, but again, thank goodness there's lots of different options available. But not only the options, keep in mind that our gut microbiome actually changes every 20 minutes, right? According to what you eat or what you don't eat. So just because something doesn't work for you right now, this minute, it doesn't mean that in a month from now, or 3 months from now, if you tried that same food or same supplement again, you may not have the same reaction.
Yeah.
So have patience and be
Yes.
willing to explore, and maybe wait till the weekend, or when yeah. So I have to stay on top of the market of all different fiber supplements. And so my significant other used to travel every other week, so I would wait until he was gone and have all the supplements lined up that I was going to try next, because gosh, some of them cause lots and lots of unpleasant side effects. So anyway, you gotta
It's nice of
right
you
timing.
to save him from those groans and bones.
Yes.
All right. We have another question.
We do. So can someone finally answer the ongoing battle between white and brown rice? Is white rice really that bad for you versus brown?
So it comes down to the nutritional content, right? You get more nutrition, a little bit more nutrition from brown rice. You get a little bit more fiber from it. Is white rice bad? No, it's not. You just get more nutrition from it. So I think, I try not to put foods into like good and bad categories, and which are more nutrient dense. Those are the ones that you want to go for. You want to get the biggest bang for your buck. So if you're going to have rice, thinking about what is going to be most nutritious versus those two. So it's not a thing about is it bad, and then the amount, it comes down to the portion amount, right? So that's the key too. And if you like white rice, there's a way to work it into a balanced diet, so you can have pretty much anything. And we don't want to. I just really stay away from putting foods into good or bad categories. It's about
Yes.
balance. So from that standpoint, if you choose this, if you were to come to me and say, "Hey, Erin, I really want to keep my white rice," okay, cool. Well, let's figure out how we can balance out different areas
Yes.
of your diet. So that's how I would approach that. versus saying no, don't have like I would never tell anybody not to do that.
Yes, yes, yes. So if we look at it from like a blood sugar standpoint, so I wear a CGM all the time, and there is a difference that I notice when I eat brown versus white rice, and many people just prefer white rice, and so there is a way to actually bring down the glycemic response, and that is to actually go ahead and prepare it, but then put it in let it cool to room temperature, then put it in the refrigerator overnight, and then eat it the next day. You can reheat it, it's fine, but by cooling it like that, it actually changes the molecule, the carbohydrate molecule, to perform more like a fiber. So it has a much lower glycemic response. Your blood sugar won't spike the way that it would if you were to eat it straight out of the rice cooker.
Yeah.
So, in addition to that, you can also add just better fiber to your rice, to the rice cooker. And that's another thing that you can do to bring down the glycemic response. So, again, it doesn't change the taste or texture of your rice. You can still have your rice. Another trick, too, is to wait till the end of the meal to have your carbohydrate. So, go ahead and have your, veggies and non-starchy veggies and protein first, and wait till the end of the meal to consume your carbohydrate or rice or potatoes, right? And then again, that's another way to bring down the glycemic response. And these are all ways that I uh, manage my blood sugar and my weight with all of these little tricks.
Awesome. That's
Yeah.
Awesome.
awesome.
Yeah.
Awesome. So we have just a few more minutes left. I think I see one more question in the chat. I'm going to respond to that as well. And that's just kind of, again, goes back to me changing your name from registered dietitians to nutrition coaches, because one of the things that I counsel my patients on when I'm encouraging them to see a dietitian, because they always think that, yeah, somebody's just going to come in and completely like overhaul their diet and tell them to stop eating everything. Again, it's about that guidance, not necessarily it's about what to eat or what not to eat. It's how to eat what
Yeah.
you're eating. And so it could be changing it to multiple small meals a day. It could be within the same meal, making sure you consume a certain portion of it before, another, so having that rice last, and how it can affect, what it has an effect on your metabolism and things like that. So Sonia, I think there was another question that kind of, came through.
Yes, the question is how many bowel movements should we have a day, and what are the other benefits of eating fiber other than just helping to increase more bowel movements?
Gotcha. So I'll take that
I was
one
gonna say.
as colorectal surgeon. So there's a range of normal. So as we've been just talking about this whole evening, everybody has different medical conditions. They're on different medications. They have a different metabolism. May have had different surgeries, and so
Yeah.
the range of normal, just if you look at a textbook, is 3 times a day to 3 times a week. Okay, but again, that's depending on the patient and their history. And so outside of that, let's talk about symptoms. So I tell folks like, hey, if even if you fall outside of that range, but if when you have a bowel movement, if you use the restroom and it's not a production, okay, when you've gone to the restroom, you feel satisfied that you've emptied,
Mhm.
and when you're waiting for that next bowel movement, you're not all, oh my gosh, I gotta go, I'm cramping, I'm bloated. So if you're not feeling those things and you're only going 3 times a week, then that is your normal. Okay. So don't try to match Peter and Paul and everybody else that's around you. You don't know what they're doing, what they're on, what, type of surgical history that they've had or medical history that they've had. So comparison is the thief of joy, even when it comes to pooping. Um, so, so we're gonna start, kind of wrapping this conversation up. I want, first and foremost, to say thank you so much to Erin and Kristin. We got our East Coast, West Coast nutritional coach battle. Such valuable information, and this was just laying the groundwork for so much more collaboration that I think we have to come from all of us. So, Kristin, tell us a little bit more about how folks can buy, find, purchase Just Fiber.
Yes. So our website is getjustbetter.com. So that's the easiest way to find us. Um, and of course, you can through the socials also. Is our business name is Just Better Brands. So if you want to Google Just Better Brands, you can do it that way as well.
Perfect. And I think, is there a
Yes.
little bit more information on the website about the research that went into like some of those studies that you had,
Yes.
that,
Yes.
that where you found the product or whatever. So there is science behind this, okay? This is not
Yes.
just, pushing a brand, which this is her business, so we want to support her. Nice woman-owned business. But in general, it is for better health, and there is science behind it. Um, and for me, again, as a colorectal surgeon, I'm the technician, cut here, put this together, fix this. And I find myself having a lot of conversations, about gut health and wellness. And so I've partnered with Erin here in Metro Atlanta. She does provide nutritional consultations, via our practice. And stay tuned. We're about to start introducing, some nutrition starter packs where we can get a combination of nutritional consultations and follow-ups and some ideas on meal plans based upon your goals. So she's licensed in multiple states. So all you have to do is find us, colawellness.com. Reach out to us. There's not an application. There's a request form online. She offers virtual consultations. So East Coast, West Coast, North, South, Midwest, you can reach out to us. And so, Erin, give us a couple of takeaways, to conclude our evening.
Yeah, come and see us. Come and see us. Make an appointment, even if you're just unsure. You have some questions, and we can go from there. And again, it's not about, like Kristin said, and Dr. Mullins said, it's not about just trying to change the way you're eating. We're really trying to help you to meet your goals, to
Yeah.
feel better,
Yeah.
to live well. So that's what this is all about. And we can help you sift through all the noise. There's a lot of information out there, whether it be social media or people just
Yeah.
talking. So let us help you make sense of it. Let us help you make a plan for yourself based on your goals and your needs. So yeah, I'd love to work with you. So feel free to reach out.
Yes, and you all
Awesome.
do like telehealth also,
Yep,
so
yep.
we can
So,
refer. Okay,
yep.
wonderful, wonderful.
So listen, we have to have another conversation at one point. We're going to
Yes.
get some recipes
Mm.
using just better fiber, and then maybe we can do an IG live at some point to taste test some of these recipes.
Oh yes,
Okay.
Yes, let's
great
do
idea.
All
Love it.
right. All right, guys. Thanks for joining us on the Love Below series. And I am excited, excited, excited. We will have a special guest next week. We will be talking with Dr. Jackie Walters, the Dr. Jackie from Married to Medicine. And we're going to talk about menopause and perimenopause and how that affects the Love Below. See y'all
Love it.
soon.
Thank
Bye for
you. Bye.
now.